So, hello everyone. I hope you're well. You've listened to our conversation many times, and I hope you are going to enjoy this conversation, which we focus solely on mental health. Are you going through mental health pain in any way? Are you a young person dealing with mental health challenge? Are you an older person and not quite sure, where do I get my help from? What do I do? Who do I listen to? Where do I even, because sometimes there's so much information out there, but you're not quite sure which information is right for you. Well, you've come out here to the right place. This conversation is truly for you. Listen to it as we speak to Dr. Antonis Kousoulis as he tells us about his own journey, why he's gone on this path as a mental health foundation director. How are you?
I'm very good, thank you. How are you?
I'm very well. I'm super delighted to be talking to you today because all your research is showing that this is not something you've just gone into just because of, mental health is something I think it started roughly about 8 years ago when we seriously started talking about it more. But for you, it's something that comes from a place of passion as well. You've done this, you're now a mental health foundation director. Before that, you had other skill sets leading on this path. Can you just tell us a little bit about who are you?
Thank you. And I love that question because who we are and our identity is just such a fundamental kind of thing. And sometimes we're not paying enough attention to actually who we are. But I am Greek by background. I grew up in Greece, grew up in Athens, in a small suburb of Athens. I was always really interested in suffering and people's suffering, and I always had a strong sense of equality for as long as I can remember myself. I was disturbed by matters of inequality, and social injustices and things like that. And I was always a carer. I was always kind of caring for people and asking people, and I thought from a young age that I actually like that identity. I like being someone that's there for people, and I could see that you can help others and get also a lot of sort of benefits for yourself. So that's what drew me to medical school, and I went to medical school, and the whole environment of medical studies was really interesting, and I learned a lot, but I also had to learn a lot of things that I then had to unlearn, if you like, because behaviors are not always kind of what you would hope for or what you would expect. And coming out of medical school, I was really interested in what makes people, because medical school is a lot about treating, and it's a lot about drugs and interventions and hospitals and things like that. But coming out of it, I was still interested in what makes people unwell in the first place. What are the causes of pain? What are the causes of suffering? And actually, can we prevent some of that? Can we make sure that some people do not reach crisis points and do not reach those levels of suffering that we see in the world? And this was my calling for public health, and I went into public health, and I started building kind of my career and expertise. Came to the UK, worked for a number of organizations. I worked in the Department of Health, Mental Health Foundation, and elsewhere. And I've been looking into communities and society as a whole, and looking at prevention and looking at helping people and whole communities, really.
Oh, wow, that's really amazing. When you look at your life, we always have that one person that has influenced us to shape us and mold us into that, because you talked a lot about being compassionate and looking at the way the medical school has done, and you realizing that even though there's a set theory on how things should be done and everyone follows those theories, sometimes you have to go backward and look at things in a different layout. Who are you? Who was your biggest influence when you're in your direction of life?
So definitely my biggest influence as a young person was my mother. She was a teacher, had a very kind of humanistic approach to things, quite a caring person, real care coming back home, real care about her students, talking about her students and the lives they were living, not just, their academic achievements, but also kind of the lives they had. So that was definitely a huge influence. And because of that, I think I'm very interested in things like literature and history and sociology, that comes next to kind of working in this space. But but I think my whole, I had influences from my family. My dad was always kind of an activist. My brother I'm very close to. I met my partner very young. We've been together for a very long time, and we moved together to London, and she's always been a huge influence on me as well. So I think lots of different kind of influences as as life goes on.
But Dr. Antonis, one thing I will have to ask you, in terms of this mental health pain, as someone, I had my own mental health challenges as a younger person. I always asked my doctor, yeah, mental health pain is not something that you could say is, someone injures themselves and you could see the wound there and you could then help that person to get better. But with mental health pain, it's very linked to an individual. So it's really what that person is actually communicating that the doctor based their answers on, right? So in your life, did you ever experience something that gave you an indication of what it truly is that somebody might be going through? Have you ever experienced something like that in your own, when you go back to your own life?
Yeah, I've certainly had experiences of mental illness and mental health suffering in within my family and in my close life, and experiences, of loss and things like that. And I think these days, with how we have addressed stigma, it would be probably a lie if someone said that I have never, had any struggles with my mental health or in my family or whatever. But I think I've observed these journeys that people really close to me have had in with their mental health, and what I noticed was that that mental health struggle, that pain that you're describing, it's not something that you are born with. There's so many different influences and circumstances in our lives that combine to cause that. And I was really fascinated by that, that there's not kind of a single explanation or a single cause. Yeah, definitely had to deal with that pain, quite close to me within my family, and I think that further cemented that desire to help and to care and to kind of understand that space more as well.
So if I'm to ask you a simple question, because everyone, especially the younger kids, want to understand what is mental health pain.
So it is very personal. It is about experiencing a sense of overwhelm. This is how I would describe it, to a point when we feel that we cannot, cope. So this is where I usually kind of demonstrate this with a glass of water, and for various reasons and from various sources, there's just too much water kind of overflowing our glass. If we're a glass, there's just too much water, and it's overflowing, and the glass cannot hold that water anymore. Yeah. So it's experiences and suffering, to be honest, for many people, that overwhelms our coping mechanisms and our coping defenses, and a lot of us fluctuate through that throughout our lives. And for some people, this can be very disabling. For some people, it can be just kind of mood swings and not necessarily going to the extremes. But it is very common. And the issue is that, as you described the difference with a physical wound, that the experience of that pain is very personal, because it's about our identity, it's about our relationships. It impacts how we work, it impacts how we interact with people, it impacts on if we're doing, our hobbies and if we're following our interests. So it's very personal in a way that physical pain is not always. Sometimes it is, but maybe not always.
So what part of it do you specialize in? Are they different in mental health pain? Are they different specialists of it, or what is it just the general side?
There are different specialties, and there are different ways to approach it. But my perspective is about taking that public health view. So I'm looking at prevention. I'm looking at how we can stay well for longer, how we can intervene early, especially thinking about young people, before things become a crisis or build up and they overflow our glass and things like that. So public health is quite a term that is on trend, especially with the pandemic. But the way I define public health is looking at the things that we build together as a society, so that everyone within our communities can achieve optimal health. So it's a very social, and collective definition for me.
Okay, because I love that you said this public policy, because public policy really affects everything. I mean, when there's a policy in place to really understand what is it that we're going to clearly define it, I think then it's easier for parents, for teachers, for your co-workers to go through those guidelines and go for it and understand, this person might be suffering from this person might be doing this. Can you get, you've been involved with a lot of policy, you've been able to relate to the government, you've done research already. In your research, I'm also working with the government on their policy. Can you give us some of the policies that have been coming out since, because it's changed a lot.
It is.
When it first came out, I think there's more understanding. Can you just give us some of those changes in what you've seen and improvement in terms of the people recognition of mental health?
Yeah, definitely. This is a big part of my job, and it's a big part of what I do. And as you say, looking at the whole systems, the whole kind of policy that affect millions of people, sometimes it's where sometimes we can achieve a lot of our impact. So things that have been changing, let's say in the past maybe 5 or 10 years in the mental health space. First, I would say we've had stigma, addressing that stigma of mental illness. Obviously, there's still misunderstandings, there's still stigma. I wouldn't say we've addressed everything, but we've seen, how many people have come out now and talking quite openly about mental health. And this has been a combination of campaigning, large campaigns like Mental Health Awareness Week, which is part of what I've been leading at the foundation, but also other campaigns, the Royal Family and others kind of in that space. Another important move has been to modernize the Mental Health Act, which is how people are treated when they are their most vulnerable. And for some people, the interaction at their greatest level of suffering, the interaction with services that they have is with blue light services, like police and others. And there's a disproportionate impact on communities of color and minority ethnic communities, especially in the UK, but also in other places. So there's been a big piece of work to modernize that and to provide more humane, approaches and approach people with, dignity and respect. So this has been a big piece of work by the UK government. We've also seen kind of smaller pieces of work in very specialized areas. So we've seen a lot of programs progress in addressing things like online harms. And the UK is actually trying to be quite a world leader in that space. There are, for example, forums that are quite toxic. There are spaces where people go and they can be quite toxic for their mental health. And there's been an attempt to regulate that space a little bit. I've also done a lot of work in the influences of like cosmetic and beauty industry, and advertising industry. And we know that especially for young girls, that's a huge, that's a huge influence. And it's quite relentless as well. One of the things we've achieved is ensuring that cosmetic surgery and non-surgical procedures are not available for young people under the age of 18, unless there's a medical need, but that has been a huge move. We've also achieved that a change in legislation to ensure that anyone who provides these operations is a licensed practitioner, even for the non-surgical ones like Botox and fillers and things like that, which are quite common, so that we prevent some of the trauma of failed operations, which is again sometimes common. So yeah, lots of changes in the past decade. That conversation around mental health has really exploded kind of into the public discourse.
Oh, honestly, I love what you said, because what you just summarized there. And even myself, I didn't realize there was this much work being done already. But one of the work I do realize, and I see all the time, is the awareness and the campaign where people are feeling more comfortable to talk about it. Because I see, you see a lot of people and they're nervous. If I say I'm not feeling well, they're not. People are going to look at me funny or have a mental health problem, because we always linked mental health to someone being very, very, should be locked up or something. That's how we've always people have always seen it. But mental health, I love the way you've calmly addressed it. But one thing I just for the ethnic minority people who'll be listening to this conversation, there's still that um tribe. There's still that culture that doesn't let people, like you see, a lot of men are not able to express their feelings when they're
Mm.
going through hardship, especially sometimes there's a lot of hardship that's going on with the ethnic minority community. It might impact them, and they might not know where to go for help. I know some of my family, aunties might ask us, where do I go for help? I don't understand it. How are you guys trying to address that need to help them really express themselves in a cultural way?
Yeah, well, first of all, it's exactly what you said. That word cultural is really important. So the thing that I do in my job is I'm not trying to do everything. You know, it's important to kind of democratize knowledge and spread knowledge and share power. And I think people within their own communities, they have the power and the knowledge and that cultural understanding and nuance of how we can approach each other and how we can help each other. So for me, a big part of the work is to empower people with that knowledge to help each other. So we don't necessarily have to do that ourselves. We can kind of spread that through community leaders and faith leaders, and people within smaller communities and minority. And and the UK is very diverse, and there's lots of different kind of identities that people identify with, and that's lovely. But it can also be quite isolating and traumatic, and we know that racism is a very strong factor in people's experiences of mental health pain. And we know that some of the things that are protective against that pain is that sense of community and belonging, and the sense of getting some power back. And you do that usually with activism, and you do that with kind of giving your voice some power when you feel that you are powerless. So this is for me the approach. The approach is to kind of work with communities rather than, instead of doing things to people, doing things with people.
That's really good. That always works because community always has a way of communicating to those members and making sure that method, that policy is well known. So as a policy, one of the things you tend to do is also work on the guidelines. What would you do, and what kind of guidelines would you say give to someone who's going through mental health pain to help them to overcome that pain and start living their life again? What would you say?
So the first and most important thing is to understand, to try and listen to your own experience and try to listen to what your body, your mind is telling you. And because sometimes, we try to numb the feelings, but it's actually really important to feel the feelings, as much as we can, because this is our body's trying to tell us something. And related to that, and on the point that you said, I think for us as people, it's important to remember that mental health is shaped by all these, circumstances that we find ourselves in. So we have to move away from the model of, there's a broken individual, to the model of actually our society is broken in several ways, and how our mental health response is related to that, to our environment. So I would start by maybe taking away some of that guilt and pain and shame that comes with that experience, and trying to process that. But there are lots of things that help, and there are lots of things that are available to many people, even if they can be hard to do. So we know that connecting with nature is great for our mental health as much as possible. It range from parks and forests to plants in our house, or herbs or whatever else. So small things or bigger things. We know that exercise is really fundamental in our whole body health and our mental health. And the best exercise is the exercise that you enjoy. So whatever you can do is fine, even if it is a little bit of walking, that's fine. We know that our food and our mood are really closely connected. And unfortunately, we go into a supermarket or we go into a corner shop, and there's lots of things that we are being sold that are very unhealthy, and they're prominently positioned, in places where we would buy them, and they're often on sale or on some kind of discount. So I think resisting some of that urge is important, and maybe grabbing something that might be a little bit healthier. You don't have to go through a whole transformation of your diet, but maybe starting with some healthy additions. And similarly, and I would say quite important is that often we are trying to sort of cope using maybe drinking, you know, or drugs. And especially alcohol is, again, very strongly marketed and very widely available. But the relief and the numbing is only temporary, and it actually makes things worse. So I think try to move away as much as possible from that way, you know, as a way of coping is important. And I will close with something I said earlier. Probably the best protective factor is connection. You know, other people in your life that you love, that you want to interact with. Um, if you can, don't isolate yourself, you know, and it doesn't have to be about your feelings. You don't have to talk about your feelings, but just being connected and coexisting with other people is just, it does wonders for our mental health.
I love the final one is actually connecting, because there was this power in just talking to someone else about what you're going through, and they could even see it at a different level, and they can give their piece of advice. You listen to it, you're like, oh my god, that wasn't even that bad. Why am I stressing out about it? So I
Yeah.
just love that community.
And you are championing that really well, you know, because I've seen in your Instagram feed, you know, you always have your family and your friends and your the young people in your life, and so you know, I love how you're promoting that connection in your life as well.
No, thank you. Because honestly, because sometimes even people see me, I say, even myself, I wake up with my own mental pain. I know some days I wake up, I'm thinking, oh my god, not today. And then all it takes is just calling one of my family members and saying, guys, I'm not feeling up for it. And we just, by the time you start chatting, you actually get what their mental health pain is. And I'm glad that this is something that you are, as a policy leader on this, you're something you're actually leading on. And when you communicate to people about what should be done, that is something that should be definitely a part of our list. Because when we isolate ourselves, then our feelings and our negative things start to multiply. And it starts to get even worse because no one else is calming that negativity down. So I'm so glad. You know, with the cost of living crisis, everywhere you go, when you read the media, it's either we're running out of vegetables, either we don't have petrol. So there's always something negative, and there's the cost of living crisis. That's impacting people in so many different ways. It's impacting people's mental health, it's impacting people's lives, it's impacting people's day-to-day life. What would you say to someone who reads this, or who even goes to the supermarket, or who can't afford to live that life they were so used to? How would you help them to overcome that mental health pain?
So it's really important, first of all, to protect yourself from the coverage, because sometimes the media coverage can get you into that stressful loop of constantly kind of being you know, stressed and actually sometimes becoming desperate about things. So I think protecting ourselves from that coverage is something, you know, is an easy first starting point, because there's a lot of uncertainty. And you know, things are changing, and you know, the support that is available, for example, from the government is always kind of shifting, and maybe it'll be a new thing in a couple of months. You don't know that now. So I think coping with that uncertainty is you know, is important, and taking some of that. We are at our most uncertain when we don't know exactly what's coming, and the media is kind of really amplifying that. So I think trying to getting some control over your life is important, over your finances, even if you're struggling. Sometimes doing a careful budget is important. There are services that support with managing debt, and I would definitely use those. And I think there's no shame in using those if you need to, because getting more and more into debt can be really detrimental to your, not just your mental health, but also your physical health. So that's really important. I think sharing with others where possible is valuable, and we can do that in nice collective ways. You know, like sharing food, or coming together in houses. You know, and kind of spending time together and sharing energy and things like that. That's really important. I think not forgetting our own health in all this is fundamental, because if it's all money problems, and if it's all money stresses, everything else seems to be seems to become secondary. And one really fundamental thing about our health is sleep. So how we sleep often suffers, when we have money problems or we have stresses of that nature, job insecurity. Um, so I would say, let's start by valuing our sleep, and if we're getting a good night's sleep, and if we're not stressing too much about insomnia, but we kind of give ourselves that time to create a good temperature in our room, and maybe listen to something that's calming. That is a good starting point. Sleep is one of the fundamental biological things that we need to survive, and it often, we often deprioritize it, and we have no good reason for that.
If I let you go, I have to ask you, so in case we meet someone who's really going through a bad time and going through this mental health pain, what would be a key advice to give that person to help them find help, or where could they even go? Where could that person who's not going through that pain, helping someone, go to find advice to help anybody that might be going through it?
Yeah, I think starting the conversation is important, and sometimes this question, "How are you sleeping?" can be a good opening, because it can tell us a lot. I would say it depends on where you are, how much pain you're feeling, and how desperate are you. And I think at the point of desperation and crisis, it's important for people to know that they can use the urgent services, the NHS. Or they can call the Samaritans, and this can be life-saving. But there's also lots of interesting and good sources to reach out to. The Mental Health Foundation website is one, and also lots of other kind of mental health charities in the UK. So if you find there's lots of good guides on those, I think there's also a lot of guides that are not very good on websites. I would try to trust certain sources and follow those. So yeah, I would start with some of those trusted sources, but important to note that some people will be in crisis, will be in kind of life-threatening crisis, and we need to stay there and be there, and also kind of guide them to getting professional support.
Finally, we've come a long way, whether we like it or not. We've come a long way. There's lots of campaign. You talked about young girls now not being able to do procedure unless it's absolutely necessary. We've talked about the reach out to true communities, for the ethnic minorities or for different races out there that might need help. You've talked about being the awareness and what we should do. These things are very, very important, and these things are things we didn't even have many years ago. We all knew mental health, or somebody might be suffering, but nobody could even ask you. Now, when you go to hospital, one of the questions put on the leaflet is that, how is your mental health? How are you feeling today? People now take that time out of their busy schedule to actually ask you, are you okay? What do you see for the next 5 years? Where do you see the advancement of mental health going in the future?
So what I'm hoping for, and what I'm kind of trying to do with my work, is we want to normalize mental health education more in schools, and start very early, and have all the schools kind of have a level of mental health training, what we call mental health literacy or emotional literacy, so that children understand their emotions and their own mental health. I also want to normalize more the concept of well-being in the workplace, and ensure that employers understand how closely our well-being is linked to how we perform at work and how we show up at work. This is important, and I think there's a lot more recognition these days. And what I'm also hoping for the next 5 years is that we will continue the mental health conversation. We continue this strong agenda. People will not get bored of it, because I know that sometimes, we shift into other things that are maybe interesting or new. But I think the mental health conversation has survived COVID. People are still interested in that. And we need to continue championing that. And if we continue championing that, we continue putting pressure on policymakers and on decision makers and employers and others, and changes continue to happen. So for me, there's huge value in that grassroots, campaigning, that sense of community coming together to demand more for their mental health. And quite often this will lead us into paths of thinking about inequality, thinking about, who is further away from good mental health, who is in the most pain, what has led to that, and how we can prevent, how can we stop some of those factors that are leading people consistently into that pain through generations sometimes.
Wow, thank you so much. I really appreciate it, because when I watch, one of the key things that you've really talked about is not just that we're use the current situation today, but it's also about the future. Because if we analyze things has improved, but there's still a lot more work that needs to be done. That normalizing, that people are not actually taking advantage of the system, but people are actually going through mental health. So there's that still stigma attached, and how we normalize that. And I think that the work you're doing is really amazing, and I appreciate it. Any final words, Dr. Antonis, before I let you go?
No, thank you, and thanks for the work you're doing. And as I said, I don't think that everything has to be done by the health professionals. I think we have a lot of power within our communities. So the work you're doing is fundamental, and within your influence, which I know is quite kind of considerable in quite a large community. So thank you for that.
Oh, thank you so much, and I wish you a lovely day. Thank you so much
You
for
too.
the information.
Thank you.
Thank you.
Pleasure.